On today's episode of Talk Legal to Me, we have Dr. Phil Shin with Arrowhead Creekside Dental. He talks about all things dentistry, how he runs his business and practice. He talks about cosmetic dentistry and how AI is making it into the field. So stay tuned. Well, thank you, Dr. Phil Shin, for coming on today.
Thank you. No, thanks for having me.
Welcome to Talk Legal to Me, and you're here representing your practice, Arrowhead Creekside Dental.
Yes, I am, yep.
And prior to us starting this episode, you pointed out that I had lipstick on my teeth, which I really appreciate. You're a teeth guy through and through.
That's the first thing I look at when I talk to people is definitely it's their teeth, and I mean I just can't help it. Sorry.
Okay. How did you get into dentistry?
Fun. I mean, I would say no one really knows that they're going to be a dentist growing up. I mean, I wish I did. I will probably wanted to be like a firefighter or a cop, but my actually own dentist brought it up to me, which is kind of ironic because growing up, I did not like the dentist myself. I was a sweet tooth kind of a kid, so I would always have to get fillings done and shots and drilling. And every time I would get my teeth cleaned, I'm like, oh, geez, I have to get another filling done. And come to college, he asked me what I'm going to do, and he said I should be a dentist. And I actually laughed at him because I was like, why would I want to do that to other people? But go about another year or two, and I applied, and I went, oh my God, I got in.
Wow.
I would say your second year of being in dental school, when you actually help someone, that's when I kind of knew that this was the field that I wanted to get into.
That's great.
Nice, yep.
That's awesome. What kind of things do you think you were good at as a student, as a kid, that helped you get into dental school? Because it's like super competitive.
Yeah, well, yeah. So right now I'm actually helping out some of these ASU students with their pre-dental society. And I mentioned the top three things, right? So you got to have the grades, right? You got to have the discipline, just like when you went to law school, right? You have to study and you have to get your grades. So there's a sacrifice that you do have to have.
Sure.
You have to be able to manage time. That's a big thing because dental school, like medical schools, there's a lot of hours that are required. You can't just take your normal 12 hours of classes. You need to be able to take a little bit more, and it also helps if you have a job or have a sport that you play, because then the schools will know that you can manage your time well. And then the last part, you got to be good with your hands, right? I mean, it's kind of what we do. You can't have shaky hands, I would say, but I play the piano, I play the guitar, so that was kind of helpful. I played sports, which kind of helped me discipline my time. And I wouldn't say I'm the smartest, be in the classroom, but I definitely put in the work to get my grades up. That's
great. That's awesome. Yeah. And you have your own practice, so how is it being a business owner and you're still practicing dentistry? You're balancing the two.
Yeah, they don't teach that
right.
In dental school. They teach you the medical side.
Right.
I do have a parent company that kind of helps me out with the business side.
That's great.
But as a leader, I would say it's my job to make sure that charts get closed out, that billing helps, or billing gets billed out correctly. The leading side is probably the biggest improvements that I've seen in myself and in my practice over the past probably decade.
How have you developed that? Because it's not like something that just comes naturally to everyone.
Yeah, so there's leadership courses that I took, but honestly, kind of like what you're doing here, these podcasts. I was a big fan of, who Simon Sinek was.
Okay, yeah.
He still kind of does some leadership courses out there.
Right.
I took what's called Bell Leadership, which was a course where my own team filled out some surveys and gave me some self-reflection of how I am as a leader.
Wow.
And just experience. I mean, the longer you practice, the more that you realize who you are as a person. Your first couple of years, you really learn who you are as an actual leader.
Sure.
I was very high micromanaging, probably not the most fun doctor to be around. But as you get older, you realize there's more to the business and to dentistry than just kind of controlling everything, if I can say it like that.
Sure. Yeah, you have to delegate, rely on your team. And they're instrumental. So
I have 15 people that are at the office, and every single one of them has a great role, and I am truly blessed to have everybody there.
That's awesome. How are you hiring people? Are you looking for someone that's going to be a good fit in addition to their skill set?
Yeah, so that's one of the most stressful parts. I will admit. This past 2 years, we did expand to a bigger office, so there are more people that are associated with the field. Hiring, I say this. I could teach you how to do the technical side, but I can't teach you how to be a nice person.
Right.
You know,
that is so true.
I hate saying that. There are a couple people out there that are just a-holes that you just cannot train them to be nice.
Right.
They could be the best technical hygienist or the best technical business assistant or the best technical dental assistant, but they're just not nice people.
Right.
And you go to the dentist, you're already kind of feeling not in the best mood because you have to get drilled on or get a shot.
Right.
It does help if you have a nice assistant or a nice hygienist that tries to set the mood right or make it a little bit more pleasant for you.
Sure. How do you build that trust with your patients? Because like you said, you were a patient yourself going in, getting drilled on, injected. How are you doing that to make them feel comfortable?
Yeah, and that's probably the hardest part because when you meet a new patient, it depends. If it's a new patient from, let's say, an existing patient, those are usually a little bit easier because that patient already explained to the new patient that Dr. Shin's going to be like this, the hygienist is going to be like this, so they already know their expectations. They kind of already have that trust already built in. I have to make sure I obtain that trust.
Right.
But let's say we do some type of marketing, a flyer, or they saw me on Phoenix Magazine, or they saw me somewhere completely brand new. That's one of the hardest things, and that's where we do have team meetings over these new patients, these situations, because it's like a first date.
Yeah.
Yeah, really it is.
You're right.
I have to make sure that the office is completely clean, because if there's a little bit of mess or something, that's their first impression at the office.
Right.
We have to make sure we're on time. We have to make sure that everybody is in the right place at the right time, that we chart accurately. And then as a dentist, I have to make sure that I do my job. So meaning that I get the patient properly numb. If we need to sedate the patient, that I do good quality work. I am not mistake-free.
Sure,
I
we're
still
human
make
beings.
I make mistakes myself. So I try to limit them, but if I do make a mistake, it's all about being honest and communicating that to our patients.
I really respect that, because I feel like what physicians oftentimes try to do, and even attorneys, it's like, we never make mistakes. We know everything we do. And it's like, it's a practice for a reason. There's a lot of things that can go wrong sometimes, not necessarily because we're not doing our best, but maybe the patient doesn't respond to a certain treatment well, or maybe they have facts in their case that aren't so great in my instances. But I appreciate that honesty that you have and you've said. So
yeah, even this morning, I kind of mentioned to you that I had to go in because I did a surgery and there was a minor complication. I can't predict complications. I mean, I wish I could, but there could be a certain case where a tooth gets abscessed and I need to go in and handle that situation there. And the patient's obviously very appreciative that, I go in and help them out, even on our days off.
Yeah, today's Saturday.
Yeah.
No one's going to really know that except for us telling them. But the fact that you would go in and help them out on a Saturday morning is incredible, instead of having them suffer all weekend long, which oftentimes does happen. So that's awesome. Phil, I want you to be my dentist. You're great.
I'm willing to take you, Gordi, no problem. Yep.
So one thing when I go to the dentist, they ask me, oh, so have you been flossing? And I say with a straight face, yeah, I've been flossing regularly. Okay, for people like me, are you like, you're full of shit? Like, can you just tell that we're completely not flossing regularly?
It's kind of the inside joke in the dental field. It's that the hygienist or the dentist, or it's the most common question.
Right.
Well, how many times are you flossing a day? We already know the answer. It's more of a, is this patient going to be honest with us, or is this patient going to just lie through their teeth?
Yeah.
If we go around and we just poked you in the arm and you started to bleed, something would not be right. Okay. So if we're going in the mouth and we're basically probing around and there's gushing blood going everywhere, it's a pretty common sign that we're not flossing flossing as much.
Okay.
So that's probably the biggest thing that I can say to patients out there. Yeah, of course, everybody most likely brushes their teeth.
Sure.
But yes, I would love if everybody would floss their teeth after every single meal, but we're all humans. But if you can floss, at least 3 to 4 times a week, that gets all that gunk in between your teeth out of there. That really helps you on the long term.
Okay, so in my car, what I've done now is I've bought like the little floss picks.
Yes.
Okay, that's probably not ideal, but is it better than going completely cold turkey, not doing it at all?
100%. So,
Okay.
yeah, I would rather you floss with those little floss. I see them on the parking lot sometimes,
They're
and
not mine. They're someone else's.
And I'm just like, man, rest in peace to that little floss stick right there. But no, those floss sticks, yeah, they're better than nothing.
Okay.
The proper way, obviously, to floss is to take a piece of string out or
Yep.
to take the floss out, floss, and then technically move it a little bit and go to the
Okay.
next tooth, because the technical side of that is you're taking the bacteria from one area and moving it to the other area there.
Sure.
So, but that's, I'm a dentist, so that's
Yeah.
just my personal way of telling my patients. But no, the floss sticks, they're great. They're better than nothing.
Okay.
And if you use those, I know people have them in their car. No, I personally would love them in a package of beef jerky, because every time I eat beef
Yeah.
jerky, I'm like, I got all that crap in my mouth. I'm like, I
Yeah.
need that floss stick with me.
Yeah,
So.
it's very critical. I even have them for my kids in the car, so they're doing their little flossing too in the car. So I'm
that's
like,
awesome.
okay, we're doing it as a family.
Yeah. And you brought up a great point. So teaching your children
Oh yeah.
that habit when they're younger,
Sure.
and especially if they see, if they see mom and dad doing it,
Yep.
your kids basically want to mirror you. So it's
Okay.
great that you're teaching your kids how to floss. That's awesome.
Okay, good. We definitely have competition in our house about who's flossing regularly with the floss sticks. My daughter's really good. She also does floss with string. I do too, floss with string, maybe not as regularly as I'd like to. One other thing that they talk about a lot is whose teeth are yellow, more yellow.
Oh yeah.
So talk to me about like some of these whitening kits that we have that we could do at home versus the professional. What's the difference between the two?
So it's actually one of the top 3 things to be Googled
Ooh.
out in the world is whitening products, right? Everybody
Okay.
wants white teeth.
Sure.
Okay. That's probably one of the biggest things I get when a new patient comes in is, Dr. Shin, how can I get my teeth whiter? Okay. So the technical side is there's 2 types of staining that makes your teeth darker. Okay, there's intrinsic, meaning that it's in the inner part of the tooth, or extrinsic, meaning it's on the outer part. So extrinsic's most common. It's like if you're a smoker, if you drink wines, coffee, stuff like that. So that attaches to the outer part. Those are easier to remove. If you use just your standard whitening toothpaste, which I kind of frown upon, because the issue with whitening toothpaste is that it's just a more abrasive toothpaste. So Gordi, I would say if I were to take a very fine piece of sandpaper, let's say 500 grit sandpaper, and smooth up your kitchen counter, okay? It would make it nice and smooth, right? But probably wouldn't take a lot
Yeah.
of staining away. Now
Right.
let's use maybe 100 grit sandpaper.
Okay.
It's a lot more abrasive. It's going
Right.
to take more of that wood away from your table to make it look cleaner. So whitening toothpaste is basically the same thing. It's just a more abrasive toothpaste. So it does get those surface stains, those extrinsic surface stains, like the coffees, the red wines. Now let's flip it over to what else is in whitening products, like over-the-counter, like hydrogen peroxide. So my biggest over-the-counter products are like your Crest White Strips. So hydrogen peroxide is an oxidating agent. It releases those bonds from the stains. So
Sure.
it takes care of all the extrinsic stains. So if a patient comes in and they want whiter teeth, well, as a dentist, I have to understand, is it extrinsic or is it intrinsic? And if it's intrinsic, like you got a dead tooth, like maybe you took some antibiotics growing up, like tetracycline,
Oh,
made your
wow.
teeth, maybe you drink some well water. So those are the things that you really can't change with your whitening toothpaste or your over-the-counter hydrogen peroxide, like white strips and products of that
Sure.
nature.
Wow, very interesting. Yeah, I feel like it's common that people just want the white teeth, like you said, and they'll do anything they can, like over the counter. If someone wants to come in and like get their teeth whitened, is that a procedure that you offer?
Oh yeah, so we do in-office whitening, but like I said, as the dentist or even sometimes my hygienist, they can educate their patients on what's the cause. So in medicine, we call that like the etiology. What's causing the staining? Is it extrinsic, like we mentioned, that we can actually address?
Right.
If it's intrinsic, then we have to go a little bit more
Right.
aggressive with treatments of like internal bleachings, or you have to cover it up with porcelain veneers or crowns or something of that nature.
Yeah, talk to me about that. Porcelain veneers. I feel like people with perfectly good teeth with Instagram and TikTok and all the videos and the photos and the filters, like everyone wants perfection across all levels. So people with what I think are perfectly good teeth are getting veneers. Are you seeing that happen more often?
Yes, I would say in the past like 8 years, okay?
Yeah.
Now, I hate it and I love it, okay? So there are all these filters and all these things that can make your smile look absolutely amazing on social media. And people are assuming like, oh, I can make my teeth look like that. There's only a certain amount of whiteness that you can naturally get.
Okay.
So as a dentist, like I said, I look at teeth. Everybody that I see, I look at their teeth, okay? And I can probably tell within the first 10 seconds if you have veneers or if you have natural teeth. And a lot of times with social media and how people are looking at influencers or even just celebrities, a lot of those are actually artificial or
Right.
porcelain veneers
Right.
or bonding or something that's not natural.
Sure.
Now, the best smile, of course, as a dentist, is going to be your natural teeth. That's going to last the longest. So
Okay.
sometimes if you just align them correctly with maybe some orthodontics and whiten them, that's going to last you most likely your
Right.
lifetime. And
Sure.
and as a dentist, that's the best, that's the best smile makeover I can do is just your natural teeth. But there are certain situations that a patient may want their teeth whiter or bigger, and unfortunately we would have to go with something that's artificial with like either porcelain veneers or with like resin composites to kind of change the shape or to change the shade. And that's kind of what my passion is now is cosmetics. Training, took probably about a decade to do, and that's something that because that's a life-changing, aspect that we do. The fillings, I love doing fillings. I love doing my crowns, extractions, root canals,
Right.
just your normal checkups. But the icing on the cake, I would say, are the smile makeovers, whether it's natural or with porcelain veneers.
Talk about like a case that you've had where you just basically changed this person's life because you've given them that smile of their dreams.
Yeah. So the biggest one that comes up to me right now, I actually shared her in front of about 150 dentists and hygienists about 6 months ago, and she gave me all the waivers because I did change,
Right.
change her life. So I was actually in a conference in Orlando. I want to say in 2015, and she's been a patient of mine for quite some time. And I just mentioned that she's had some really worn down teeth, and I was kind of warning her about her front tooth, thinking like that could break on you one of these days.
Oh.
And I was in Orlando, and she called me crying.
Oh, no.
And the worst thing happened is she broke off her front tooth on her gum line. So I go to all these dentists, like I said, it was about 150 dentists and hygienists, and I said, would you take $1 million to lose your front tooth? And almost everybody in the room was like, there's no way.
Hell no.
Yeah. I mean, really,
I wouldn't.
I mean, you think about it, because as a dentist, I think, okay, there's so many complications to make that smile look perfect again if
Yeah.
you're missing your front tooth.
Right.
Okay. So anyway, she called me and I called her back, and it took about 1.5 years, working also with a great specialist of mine. He's a periodontist. And we rebuilt her smile. And majority of the patients that I have in my office that get like a smile makeover with me, I give them a little photo shoot, and I put one photo on the wall. I call it my wall of fame. And she now comes in every time, and she loves her new smile, and she has her confidence back. But for her to go through that that time of her life where she
Right.
was crying and she lost her front tooth.
Oh my gosh.
And it took about, we had to do some orthodontics to get her bite right. We had to put an implant in. We had to make sure the gums, that's one thing that people don't realize is when you have a great smile, you have to make sure your gums, the frame around your smile is accurate as well.
Right.
And it took about a year and a half to get, from start to finish. But now she is, she smiles everywhere. She tells everybody about me.
Oh my gosh.
And the periodontist is Dr. Kimball out in by my office as well.
Very cool. She's a walking billboard
Oh
for
yeah,
you.
yeah. Oh, usually every patient that gets work by me is a walking billboard. So I have to
Yep.
make sure the work is done correctly.
That's awesome. A lot of it is word of mouth. A lot of people probably just in the neighborhood and local schools and whatnot, if they come visit you or have their kids see you, I'm sure it just, translates to a great word of mouth recommendation.
Mm-hmm. Oh yeah.
Wow, amazing. Now, how much would a set of veneers cost nowadays?
Yeah. So it's all, I assess it by what the patient is wanting. Okay. So when I was interviewed by Phoenix Magazine back in 2021 with the Top Dentist Magazine issue, I said one of the biggest things that most people don't realize is that yes, the dentist needs to know the technical side of doing, the veneers or the bonding or how many to do. But there's actually another person that's involved that makes the dentist look good, and that's the lab ceramist. So, and the thing about labs is that the more difficult the veneer case is, obviously the higher the procedure is going to be. So now let's take insurance aside, because I do take insurance, and insurances do dictate the fee of what I can charge for a veneer case. But if it's a fee-for-service patient, which most cosmetic dentists are, if it's a pretty straightforward veneer case, you're probably looking at about, I would say, $1,000 to $1,200 per veneer. Okay. If it's a little bit more challenging of a case, like if the patient has high expectations, if they want all those little perfect details in each single veneer, I've had some labs, charge almost 3x of what my lab bill would be. So now we have to charge almost $1,800 to maybe even $2,500 per tooth. Obviously, location's a big impact as well. So we're here in Phoenix, which is a pretty above average location. I know if you go to like Beverly Hills, they're charging almost $3,000 to $4,000 a veneer. If you go to some rural areas, they're going to charge you less. We can talk about tourism, dental tourism that I see, which is you go across the border and get work done, which there are other pros and cons, okay? So I can definitely talk more about that, but they can charge probably like $500, maybe half the cost of what it would be here in the States. But it does come with the risk, of course, of what, what's going to happen with your outcome there.
Do you see patients going to Mexico to get like the set of veneers? They come back to you because like something went wrong?
Oh, yeah. So I just had one on Friday. So
okay.
And there's nothing. I would say this: everybody has their beliefs, and I call it their risk assessment. Dental tourism, meaning that you go across the border to go to maybe to Europe, to here in Arizona, just down south to Mexico, and get your dental work done. I would just advise, do your research. Make sure that you see some before and after photos. The biggest thing that I would say here in the States, we have two things that protect the general public, One is obviously malpractice attorneys, And number two is, the most common, is your state dental board. And the state dental board is here to protect the public. So meaning that if I do anything wrong, if I neglect a patient, if I cause damages to a patient, there are rights and there's protection for patients here in the United States, Unfortunately, if you go down across the border, I don't know if there's any rights for you. So if something were to go wrong, let's say you get a complication, let's say it fails. I had a buddy of mine go down south, and I'm like, "What are you doing?" Like, I'm one of your good friends.
I'll do this on a Saturday for you.
I'm one of your good friends. Just call me. And he's sending me photos, and I'm like, "You need to go back." He's like, "I went to Mexico," and I just like, I literally put my head up and I was like, what are you going to do, man? Like you have to drive down there, and what, is there a legal system down there? Is there a state board down there to protect you? I don't know, if any of that's going to help you, but at least I know here in the States, there's attorneys that can definitely protect you, and obviously, dentists themselves have to have attorneys to protect ourselves.
Sure.
But then the state board, I would say the state board, their number one job is to protect the public.
Okay.
And if you ever have an issue here in the States, that's why we do have our state dental board here.
Do you take patients who have it go wrong, or are you just I don't want to touch it? I'm not dealing with this.
So there's two sides to that, right? So
Okay.
one side of me, I want to help them out.
Right.
The other side of me is, yes, if I touch this, I'm now involved with this. And if it's something that, let's say I had a patient get some implant dentures down south of the border and had some severe post-operative infection, and I'm not in the specialty that understands
Right.
how to deal with those types of infections, so I didn't want to touch that patient.
Yep.
So I referred that patient to an oral surgeon by my office, but in my mind I went, you saved maybe half that cost to go down south, but now you're probably going to have to pay probably double the cost of what it would have been, because you have to have someone that has to deal with that issue
Sure.
and now fix it. So but I'm not going to say anything, terribly 100% wrong with everything that goes with dental tourism, because there's, I do see work that's done well, and
Right.
I tell the patients, that's a very great filling you had done, or a great crown, or a great veneer. Just manage it. Let's
Right.
move forward with it. But I would say the ones that I do see that go south are the ones that I'm just like, man, there's a lot of things like, do I want to get involved with this? Do I want to attempt to fix this? Because sometimes it's almost impossible to fix, because the
Right.
dentist has already done too much damages to the patient there.
Right. It's you can almost never make them happy.
Yeah.
Because it's so bad.
Yeah, that's one of the hard, and that's the sad thing that that unfortunately does happen sometimes, where I feel terribly bad. I do try to have sympathy for the patient, but
Sure.
one side of me is just like, this could have been easily corrected or handled correctly the first time.
Right. Like your friend.
Yeah. No,
Why did you just not call me?
That's where I was just like, call me,
So odd. Maybe you just don't want to bug you.
Yeah.
Kind of like that. But now he's got an issue to deal with. So.
Mm-hmm.
Okay, so there's always something I've heard about dentists. This is a rumor, and
Mm-hmm.
I don't know where it comes from. I don't know if it's statistically backed, but they say that dentists are more prone to committing suicide. Is this true? Not true? Because the dentists I've met, like yourself, you guys are great people, and I mean, not to say that anyone going that route is not a great person, but I'm not seeing any mental health issues pop up. Not a psychiatrist, but I'm just saying.
Well, thanks, Gordi. No, that was. It was actually, and it's funny because patients will actually bring that up to me, right? I'm just like, do I think like do I look like I'm going to commit suicide?
I'm okay.
I actually brought that up at my dental school interview.
Okay.
So this was back when I started dental school back in 2000. This would have been 2005. So was it 2005? So I asked the faculty member. I said, why? What's this whole rumor that dentists, or not even a rumor, I think it's a stat, that dentists have one of the highest suicide rates. And the faculty member actually pointed out 3 great reasons for this. And I actually looked at it and I said, holy crap, some of this actually applies to me. So number one is going to be the medical field or the medical profession. Okay, most doctors, they're perfectionists. Okay, so we grew up getting straight A's. We grew up doing everything almost perfect. So we're used to having a lot of perfection in our life. So think about what a dentist does. We work in this tiny 3x3 little oral cavity, and we're dealing in millimeters with porcelain, with plastic, with etchants and bonds and cements, and we are raised, or in our mindset is to be perfect, and yet in the mouth it's almost impossible to be absolutely perfect.
Right.
Okay, so one of the biggest things is failure. Okay, and in the medical field, or at least in the dental field, there's 100% going to be a failure in a dentist's career. Okay, so that's one of the hardest things. I have a newest partner in my practice, and she just graduated dental school about 2 years ago. And one of the first things I mentioned to her, I said, you're going to go through failure. And I want you to go through it early because then you know how to deal with it. And the first day that, I don't want to wish failure for her, but one side of me is like, I kind of want you to deal with it earlier in your career so that you know how to handle it.
Right.
Because the longer you get in your career, the more stress you may have, and that could escalate into something that, unfortunately you could take your life on. So it is a serious situation that I think medical professionals deal with. So perfectionists and not being perfect in the mouth is number one, okay? Number two is going to be we deal with people that aren't the most happiest people to come in. And it's not like, I hear it all the time, no offense, Dr. Shin, but I just hate dentists. And I'm just like, I just met you. Like, I don't even know who you are. Like, you already hate me? Like, I'm a nice person. Like, look at my smile,
Yeah,
like,
I'm going to give you a toy at the end of this.
Like, here's a popsicle. Like, but they come in, and I say it all the time, let's say you have a toothache. Your body language is just, it's kind of negative when you come in.
Right.
Let's say you have to get a filling done. You have to get a shot in your mouth. And funny story, I don't want to get too sidetracked, but I had, I'm in my 40s now, and my back's starting to act up, so I had to get a back injection.
Wow.
And I'm literally like in the parking lot going like, what the hell's going to happen to me here? Like, I'm freaking out.
The fear.
And, the fear. And Dr. Baker, he brings me back and he's like, are you okay? I'm like, actually, I'm kind of nervous. Like, I'm kind of freaked out. Like, and he's like, he could tell that from me.
Sure.
A good doctor, we usually can tell from body language. If you have anxiety, if you're nervous, if you're in a bad mood, X, Y, Z. So he's just like, oh man, this is a piece of cake. We got machines that are gonna basically inject this into your back. He's like, dude, you're a dentist. You inject in the mouth. He's like, I hate going to you. And I'm just like, oh my goodness. So he brought up the same point. Like, people have their body language going into the dentist. So we see that over the years of people that just, they're not the happiest. It's like if you go get a massage, you're going to be happy going to go get a massage. Getting a facial, you're like, oh, I'm going to get a facial. It's like how many times you go get a filling done, you're like, oh, geez, I can't wait to go get, that filling done. So
you're right.
So that's number two. And then number three, obviously the field dentists they have access to some pretty bad medications, okay, meaning nitrous oxide. There was just a case that just got published. A dentist got caught with I think 30 canisters of nitrous oxide in their car. Wow. I've seen episodes or I've seen reports of dentists, abusing opiates, narcotics. So we have access to a lot of really bad medications. So failing, perfectionist, bad, body language, always coming into the office, and access to some pretty hard medications. Those three are probably the reason why dentists have, one of the highest suicide rates there.
Okay, so it is true, and it's like that combo is like a recipe for disaster if just perfectly aligned with that person. So yeah,
and that's like I said, that was that faculty members' reasoning, and I kind of agree now. I've been practicing for almost 15 years now, and I see the stress that I go through.
Yep.
I see the people coming in. I sedate people, so I have access to all these really bad. I mean, I haven't I don't take these medications, but I've definitely, it's in the palm of my hand that I have all these medications that if you abuse them, they could be very, very detrimental to your life.
Wow. They're like, do you still want to do this? Do you still want to be a dentist? After you ask the questions, you're like, I think so.
No, I mean, there are some good rewards, obviously, with the field, but there are some sides of it that most of the general public are not aware of that we're involved with.
Right. Interesting. Yeah, I had always heard that. I'm like, I got to ask him that.
Yep.
What would you say, okay, if you have smiles and they're coming to you and they're not the greatest smiles, what are like some of the types of people that are coming to you and you're like, man, these groups of people just have crappy teeth? Like, what are they doing in their life that's like lending to some bad smiles?
Well, the biggest thing is just, neglecting your teeth, right?
Okay.
I mean, I wouldn't say like, Some people think genetically I had bad teeth or
I've heard
something.
that a lot.
And I will say that there are a certain group of people that, yes, maybe their enamel is a little bit weaker, or maybe they grew up, not growing up, but maybe they have the anatomy of their teeth are like little pits and fissures that they can't clean. So, but that's not going to lead down to just losing all your teeth. I would say neglect, and the prime range would be, so we most grew up on mom and dad's insurance. We get our cleanings, and then we graduate from college, and maybe we go off of mom and dad's insurance until we get a dental insurance.
Right.
And there's like a 5 to 10 year window that we're like, okay, we haven't even got our teeth cleaned yet. So that's probably the biggest thing that I try to message to all my patients that are going through that. I say, just get your darn teeth cleaned, right? You know, if you have cavities, yes, try to get them done, but get the hygienist to just clean your teeth, get all that gunk out of your mouth, okay? Because if you don't clean them, obviously that just adds up. And that's where gum disease and that's where decay can get involved with. But the other aspect is definitely the drug abusers, right? So, the meth mouths out there. So that really takes effect within a matter of months.
Can you tell if someone comes into you and they like use meth? Can you tell like if they're maybe just starting?
So it's the classic is you just see it's just rampant decay in their mouth.
Okay.
So
all
it's,
over.
Yeah, it's just black and brown all over their teeth.
Wow.
It's yes, as a dentist, I want to help them with their teeth, but as a human being, as a doctor, there's bigger issues that we have to deal with here. So it's just, I mean, my field is just the mouth, whereas I'm more concerned about the person in general.
What are some types of like injuries to the mouth that people are coming to you for?
Because the big things that I see is like obviously that,
accidents on the
and then
scooters.
and then the damages that occur. So remember I said about like the $1 million?
Yes.
Like, if you get into a terrible accident, I'm just thinking to myself, like, what's the price if you have now a crappy smile the rest of your life? That's just like a dentist has to do their job, but I've been a part of like a couple like expert witness cases where I'm now like assessing things.
Yep.
And this one, she was an ASU student, and her mom was a dental assistant, and she's trying to get like $500,000 out of her doctor because the doctor like screwed up her teeth, because she's like, I have to now get veneers, and this is going to affect me for the rest of my life. And in my side, I'm like, holy crap, I feel bad for the dentist, but I'm just like, what's the price of I mean, she's a beautiful girl too. And I was just
and
like,
young and all that.
I mean, I hate saying it, it was a pretty bad case that, I had to kind of like be the witness for, which I never want to bash on other dentists, that's like the last thing I want to do, but it's like, that's something that's part of the field too. But yeah, we can do.
Okay. Yeah, let's do that. So what are some types of injuries to the mouth that you're seeing people come in for?
Yeah, so that's something that we, as a dentist, you can't just go to the emergency room. So let's just say, because, the emergency room, they're most likely just going to get you like an antibiotic, right? So let's say you get into an accident. And the most common types of accidents that I'm seeing on an emergency basis are going to be your typical car accident.
Right.
Those scooters that are out there now, those bird scooters.
Yeah.
Anybody listening to this podcast, do not drink and ride one of those bird scooters, okay? Because
that's like a typical old town Scottsdale night.
Yeah. I've seen so many beautiful, smiled people literally ruin their mouths from a scooter. Actually, a good colleague of mine actually went into a coma on one of those scooters.
Wow.
So those scooters, those electrical scooters, that's a pretty common type of accident. I mean, obviously your sports, if you get into a fight, if someone obviously hits you or do anything, I mean, those are some of the injuries. So most common type of injury is going to be then your tooth falls out.
Wow.
Okay. So remember I said about out of all those dentists and hygienists out there, or even to all your podcasters, would you lose your front tooth for $1 million? Okay. Some people are like, oh my God, that's $1 million. But on the other side of it, that's the rest of your life.
Yeah.
That's your front tooth. That's what people see when they first see you.
Right.
And unfortunately, there are some people that, maybe had a bad childhood or something that lost their front tooth and they kind of got into that situation. But as an adult, if you fell or if you got into a car accident and you hit your face on the steering wheel,
right?
And I've had a case where all the front four teeth got pushed inwards. Okay.
Wow.
I've had cases where the front tooth came out. Okay.
Wow.
It's one of the most difficult things to restore because you're going to obviously get some bone loss. You're going to change the architecture of your smile. So if you have a very high smile, now we're talking about teeth being different sizes.
Right.
So cosmetically and confident wise,
right.
So those are the things that can affect you down the road. And I know I had a case where somebody had an incident done by, like, let's say a dentist or a friend, and I had to be an expert witness on the evaluation of their smile. And I think the client wanted something around the lines of like $500,000
wow.
of damages because she was thinking that I have to get all veneers done.
Sure.
My self-confidence is going to be down. And
right.
then, veneers aren't forever. I usually tell patients, a great lasting veneer case would last you 10 to 15 years if your bite's good, if you manage it good, because
sure.
it's glass. You're going to chew with these. Your gums may recede a little bit in the future. So if this young lady she was a student at ASU, and she's thinking, I'm going to have to get these replaced probably, what 3 or 4 times in her lifetime.
Oh my goodness.
The damages that occur to her
sure.
self-confidence and stuff.
Right.
It was not a good situation, and I felt really bad for her because of the incident that happened. But
right.
if you get into an accident, if your teeth fall, so the first thing to do, obviously, if a tooth does fall out,
what do we do?
Keep it in or try to push. Don't take it out. Okay.
Okay.
You have to call your dentist. Because you get about an hour. Okay.
Ooh, okay.
There's a thing that's alive on your tooth. It's called your periodontal ligament.
Okay.
So if let's say Gordi, you're a patient of mine,
right?
And you call me on my cell phone because most of my patients have my cell phone and say,
okay.
Dr. Shin, you won't believe it. My daughter, she fell and her front tooth fell out. Okay. I would say, Gordi, keep it in her mouth. If you can put it back in the socket, try it. It's not going to be most pleasant, but do it. Okay. I'll meet you at the office, and I'm going to have to try to splint it, because if you keep it out, okay, the common myth was like put it in milk. Okay?
Yeah, I was going to ask you, is that a thing to do or no?
It's better than nothing. Okay. But I would just say if your daughter wouldn't let you put it back into the extraction site that it came out on, I would just say keep it in her mouth. Put it like in her cheek, like a chickmunk or something, and I'll try to meet you at the office. We'll get her numb, and I'll, put it back in, because that hour is the most crucial when it comes to these incidents. Most people would just go to the hospital, and unfortunately, the hospital, there's no dentists that are there that are going to do much there. But yeah, you get that 1 hour. It still can be successful, but the prognosis long term is going to go down much higher.
Sure. That's a great tip for anybody. Yeah. I feel like, how have I been a mom for 10 years and not known that you got to stick it back in the socket?
Well, if your daughter will let you too, because it's not going to be the most. Usually, there's going to be some type of fracture in the mandible or something of that nature.
Right.
But if you can either keep it in or put it back in place, and then call your dentist, and then the dentist should, if it's during office hours, so there are certain times where, let's say your dentist runs late because of an emergency. Okay. Yes, we all want to be on time, but there are certain times when I have to see this person within an hour, and let's say you got scheduled to do a filling, and I go, hey, Gordi, I'm sorry, like I had this little girl fall, I have to go.
Yeah.
And you being a mother, you'd be totally
I would be so fine with that. I'd be like, I'll come in another day.
Yeah. But those are the certain, just because as a dentist, we have to be able to see that person, right away to put that tooth back in place.
Wow. Great tip.
No, thank you.
Everybody needs to know this. So talk about dental integrity.
Yes.
Because I feel like you hear these stories where someone goes to one dentist and they say, oh my gosh, your mouth is completely messed up and it needs all of these things done. You go to someone else and they're like, nope, it looks good. Yeah. How do you reconcile that?
Yeah, that's one of the hardest things, and probably the biggest thing that I probably deal with when I get a new person that comes in my office. I went to Dr. So-and-so. Dr. So-and-so said that I have, 5 cavities, some periodontal disease, and I come in and I see, and maybe my treatment plan or my diagnosis differs. Okay, so that could be very confusing to the general public. Okay, so every dentist is going to have their own philosophies, right? So some dentists are going to be a little bit more conservative. Some dentists are going to be a little bit more aggressive when it comes to their treatment planning. And that comes with their skill set and their experience and their knowledge, okay? But what's coming out that's gonna be probably the biggest game changer is now things are getting a little bit more objective. So meaning that subjectively, I can say that you are needing 3 or 4 fillings. Another dentist may say that you are needing 8 fillings, okay?
Right.
But now with AI software, okay, it's coming out where objectively we can look at x-rays or we can look at a scan of a mouth and say that's decay, that's periodontal disease. So probably in the next 10 years, I see the dental industry going towards, you may go to a kiosk, Gordi, and get a scan done and get your x-rays done, and it's going to now tell you exactly what's going on in your mouth. Okay.
Wow.
There are still going to be the dentists that, like for me, the best clinical way that I'm going to observe decay or any type of measurement is my clinical exam, right? My eyes. I know AI, I have it in my office right now. It's reading my x-rays. It's help guiding me. And I'm assuming with with technology getting better and improving within the next decade, it's going to become a little bit more objective.
Interesting. That is really interesting.
Yeah. But when it comes down to it, I would say it comes down to trust, right? Medicine's all about trust.
Right.
And I tell people that are looking for a dentist, first ask your closest friends and families that have been seeing their dentist. The big red flags that I would have is that if a dentist hasn't been in that office for, let's say, over 2 years, okay, if they're just going from office to office, that's usually a sign that, first of all, they don't see the work that they've been doing.
Oh, sure.
And they probably don't have at least a little bit of care towards their patients. So I've been at my office for over 10 years now, and it's one of the best things is when I see my patients that were like maybe teenagers that are growing up, or even if they're retiring, it's that relationship and that trust that you have. But the thing that is going to change dentistry or even just medicine is this whole AI thing. I mean, there's now there's robots out there that are placing implants. There's machines out there that are basically diagnosing things in the mouth. Or I mean, I hope I still have a job in 10 years, but
correct. Likewise.
it is coming out there, but you have to embrace it, right? So every patient deserves the best care. And as a doctor, I have to make that decision to say, is this technology helping the patient? And if that answer is yes, then I have to accept it, because our number one job is to help the patient to do no harm. And if that implies embracing AI technology, I have to accept that.
That's really admirable, and I'm glad that that's your stance. It makes me feel more comfortable going to the dentist, So, well, what are some things that you do to keep saying, have balance in your personal life, because your professional life is just so go, go, go?
Yeah. I mean, well, even my outside my extracurriculars are, I love to be go, go, go. That's just who I am. I mean, if you come to my office, I'm pretty fast paced. I run a pretty busy office, so I like to be busy. But outside, I mean, we live in a beautiful state. I mean, here in Arizona, I mean, I wish I would take more advantage of everything we have. I love to golf. Got into Ironmans, so that was something that probably contributed to my back. But I love the whole competition, and I love always having something to do. But and then obviously I'm married with a great wife, and she keeps me busy as well. And we have 2 dogs that we like to take on trips and stuff. But I do like to always have something to do or stay busy. Yeah, that's just the personality that I have.
That's really good. Now let's do like some rapid fire questions. Where have you traveled to that you just think is amazing that everyone needs to go to?
Well, Hawaii is probably the biggest. I
Okay.
lived in a van in Hawaii, and I got married in
Really?
Hawaii, so that's probably one of my top places there.
You lived in a van in Hawaii. How are you
Yeah.
going to gloss over that? You got to like talk about that.
Yeah, so my childhood best friend and I, we basically, after we graduated undergrad, I took a year off. So
Okay.
I got accepted in dental school my sophomore year, and you get to pick your graduation class. So
Sure.
my dad told me, take a year and go do what you want to do, because once you graduate, you're gonna get in the work field.
Right.
So Casey and I, we went to the Big Island, and
Wow.
you become really good friends with somebody when you sleep in a van together
Oh
with
my
that person.
gosh,
But
yeah.
it was awesome, taught me. I worked construction, got to meet some people. I'm a surfer, so
Wow.
got to surf. And a funny story. All my team and my patients know this. I actually wanted to try to stay another year.
Oh,
And
okay.
I told my mom, I'm like, hey, I think I might want to do this for another year. Yeah. She put a stop to that. She
Yeah.
flew my ass home.
She's like, hey,
Yeah.
it's not turning out how I thought it would. You're coming back.
It was awesome, but yeah, Hawaii was a great spot. I really haven't traveled outside the states that much.
Sure.
Mexico, going down south. I'm a
Yep.
big Cabo guy. I love
Yep.
to fish.
I love Cabo.
But
Exciting trips coming up?
going to Europe for the first time, so that's gonna
Ooh,
be
cool.
something exciting. So we're gonna fly into Paris and going to Rome.
Wow.
But my nationality is Korean, and unfortunately, I've never really been to Korea. So I'm
Yeah.
gonna try to do that next year. So
That'd be cool.
as you get older, you realize there's more to life than just working, right?
Sure,
obviously.
you want to enjoy
Yeah.
your life as well and kind of get that fruits of the labor. You've worked so hard.
Yeah, you definitely. I mean, traveling's fun, but just free time, spending time with your family.
Mm-hmm.
I lost my dad about 4 years ago, so
Oh, I'm sorry about
it,
that.
it kind of changed my view of life, and really
Sure.
realizing that, hey, it's never too late to just pick up the phone and call one of your parents, or
Right.
even one of your childhood friends, because you just never know.
Yeah, are you still friends with Casey?
Oh yeah, I just
Oh my gosh,
yeah.
that's great.
Yeah, he's I got him into doing an Ironman, so he did an Ironman, and I just called him, and he's like, I just hiked 20 miles, and I just went, oh man, I just like gained like 5 pounds, and now. So
Where
those
did you do the Ironman at?
we did our Ironman together in Santa Cruz. So we grew up in
Ooh.
just in Monterey, California. So it was a kind of fun one to
Yeah.
do. So if you know California, Santa Cruz is on the top part of the
Yeah.
bay, and then Monterey is on the south part of the bay.
Right, it's a beautiful area
Yeah,
of
it
the
was-
country.
yeah,
and
very,
the
very
weather's
nice.
always nice.
Yeah, you get a little bit more of the overcast in Northern California. It's not like
Sure.
San Diego type, but yeah,
Right.
it's pretty much 60 degrees
Yep.
year round there.
Wow, that's amazing.
Yeah.
Yeah, well, at least you have somewhere to go visit in the summertime when it gets too hot here.
Yeah.
What are some of your plans for the rest of 2025, either professionally or business-wise, that you've set goals for that you want to achieve?
Yeah, so professionally, still working on my accreditation through Cosmetic Dentistry. So
Wow.
most people probably don't realize that cosmetic dentistry is actually not a true specialty in the field of dentistry. So there's actually 12 specialties in dentistry. Most, your orthodontists, endodontist, oral surgeons, pediatrics, radiologists, pathology, stuff like that. So cosmetic dentistry is actually not a specialty yet, but one of the biggest associations in cosmetic dentistry is what is called the American Academy of Cosmetic Dentistry. It's AACD. And that's where I usually tell patients or friends and family that are looking for a cosmetic dentist to go on their website, because it's an objective way to see dentists that have passed certain criteria. To get your accreditation, you have to pass 5 perfect cases. And Gordi, when I mean perfect,
Wow.
I mean perfect.
Yep.
Like everything has to be perfect in the smile, in the gums, in the angulations. And how it works is that you submit about 20 photos of before and afters, and there's a group of accredited dentists that either fail or pass you.
Wow.
And I've passed 3 out of the 5, and I failed many times, and you realize how difficult it is to get your accreditation. So the annual conference is actually coming up next week, actually in San Diego. So I'll be going back there to just touch up my skills in the last 2 so that I can become an accredited dentist. The reason for it's just my way to get my skill set. I already do a lot of cosmetics, but I definitely want to become an accredited dentist there.
Wow. Very cool.
So that's one of them. And then just growing the practice. We added another provider, another doctor, getting her situated, mentoring her. I do mentor throughout, the company or throughout the country as well. And just helping out, giving back through ASU. I have a couple of these, students coming in and shadowing me,
that's
which
cool.
is it's exciting because you go back to your college days, and I'm just like, man, I didn't do this right, and I'm just like, man, that's so awesome. Your passion, coming in on your day off, right? Or I mean, I'm assuming they're going to class and then they're driving all the way to my office in Peoria, and I can see how eager they are, and it's my way of giving back because growing up, I mean, I didn't have a dentist in my family or anything like that, and it just helps for them to see what I do on a daily basis. Right,
to get more familiar with the profession, to have the confidence. That's great. That's amazing that you do that. I love that. Tell everyone, where can they find you if they want to locate you, follow you? What's a good way for them to reach you guys?
Well, I'm mainly on Instagram, so my Instagram is Phil_Shin. You'll see Smiles by Dr. T. Philip Shin. My office is Arrowhead Creekside Dental. We're in Peoria, Arizona, so that's just northwest Phoenix. Other than that, I mean, I'm out here. I live in Central Phoenix. Yeah. You probably see me at a Suns game, a D-backs game, or at the golf course. I love the area. I love what I do, and.
That's awesome. That's awesome. I really appreciate your time. Thank you so much for coming on and sharing your story and insight. And thank you.
No problem. Thank you for having me.
Thanks. Thank you for tuning in to Talk Legal to Me. Remember, you can listen to us everywhere you get your podcasts, including Spotify and Apple. And if you want to watch along, visit my YouTube channel at Lawyer Gordi. Until next time, stay informed, stay legal, and stay fabulous, besties.